In an era where many Americans are finding it more difficult to afford high-quality health care due to rising healthcare costs, I find it interesting that health insurers' profits are growing by billions of dollars just in the last year. This week, an article in Fierce Healthcare highlighted the steep increase in earnings realized by many major insurers over the second quarter of 2019. Much of this profit increase is thought to be due to the benefits of creating a much smaller competitive market through mergers and acquisitions. For example, CVS posted a profit in the second quarter following its acquisition of Aetna and Cigna. After purchasing Express Scripts has also seen its revenue climb from $11 billion to nearly $35 billion in just over a year. In many cases, insurers are partnered or share ownership of multiple stakeholders in the healthcare pipeline, such as hospitals, hospital systems, pharmacy benefit managers, and obviously entire healthcare systems. While politicians crisscross the country campaigning for your vote for president and giving lip service to healthcare reform, and making things better for patients, our nation's health insurance industry has grown without much government interference, all under their watch. Regulators have allowed the creation of mega companies that in many cases can dictate prices and coverages for patients and doctors. Some patients have little or no choice, and many markets, there's only one or two options. These insurance conglomerates are able to negotiate contracts with hospitals and effectively lock out competitors for entire geographies. This raises prices. The effect of limited competition is exactly what you'd expect: higher prices, lower quality service, and more limited product offerings. While insurers are growing stronger, more powerful, and larger, patients and doctors are losing control of medicine. Insurers can now dictate who a patient sees for care, where they see that particular provider, what access they have to advanced treatments, and ultimately, if they receive care at all. Patients have lost choice. Doctors have lost choice. So what can we do? Unfortunately, I believe that we've all allowed this to happen while we were asleep at the wheel, or, in the case of doctors, busy taking care of patients and dealing with the wasteful and useless government-mandated electronic paperwork and EMR documentation. But we must act now. We must demand more from our nation's leaders in Washington. There must be more oversight, and we must limit the ability of large insurers to hold both doctors and patients prisoner, all the while lining their own pockets with billions of dollars in profits. We must fight to preserve competition and allow both doctors and patients to have more choice in how, when, and where high-quality medical care is delivered. If we do not, insurance companies will continue to grow their profits, all on the backs of underserved and undertreated patients, not to mention overworked and burned out physicians.